Next presenter is Dr. Hiroto Kamoda. The title of the presentation is The Examination of the Spinal Seeding Cases by Metastatic Tumor. Dr. Kamoda, please.
Okay. The spinal seeding is a style of metastasis that is usually observed in advanced stage patients. The incidence of metastasis is known to be less than 5% of all cancer patients. In this study, we conducted a retrospective evaluation of our experience with spinal seeding cases to analyze the prognosis factors. Methods. All patients who had one or more lesions of intradural, extramedullary spinal metastasis detected on gadolinium-enhanced MRI were included in this study. Overall survival was calculated from the diagnosis of metastasis until the last follow-up or death. The effect of potential factors on overall survival was analyzed through univariate and multivariate analysis. Results. 19 patients that were treated in our hospital between 2010 to 2017 were included in this study. The average age was 57 years old. Their performance status at diagnosis was PS0 to 1, 6 cases, PS2, 9 cases, and PS3 to 4 cases. Their primary lesions are 7 cases of breast cancer, 6 lung cancer, 3 lymphoma, 2 colorectal cancer, and 1 gastric cancer. Their median survival time was 59 days. This slide showed the symptom metastasis. This slide showed the symptom that triggered the diagnosis of spinal metastasis. Muscle weakness occurred in 10 cases. In 3 cases, they had no symptom metastasis detected at the first visit of our hospital. Appetite loss was observed in 2 cases, sensory deficit in 2 cases, and limb pain in 2 cases. This slide shows the site of metastasis. 11 patients had their lesion in cervical cord lesion, 14 in thoracic cord level, and 11 had lesions located below cornus. Most of them had multiple metastatic lesions. This slide shows the examination findings at the time of diagnosis. Brain metastasis was confirmed in 17 cases. 13 of them were cerebellar metastasis. Sensory deficit was observed in 15. Paralysis was seen in 10 cases, and in 9 patients, tumor cells were detected in their cerebrospinal fluid. Here you can see the method of treatment. Whole spine radiation was performed in 11 patients. Intrathecal chemotherapy was carried out in 9 patients, and systemic chemotherapy was tried in 1 patient. The agent used are shown on the right side. This is the result of univariate analysis. As you can see that patients having cervical lesion and paralysis showed poorer survival times than those who are not. And patients who had received intrathecal chemotherapy showed better survival times. In contrast, age, performance status, CSF examination, and radiotherapy revealed no significant impact. This is the result of multivariate analysis. Having cervical lesion and intrathecal chemotherapy continue to be significant. Discussion. Metastasis to the intradural extramedullary space of the spinal column is a rare but severe complication of systemic cancer. The average age of patients at diagnosis is in their 50s, and when left untreated, neurological decline usually progresses to paraparesis or quadriparesis. There are some reports about the mechanisms for the spread of tumor cells into the spinal cord. They said hematogenous dissemination, direct extension, and virus CSF pathway were considered common mechanisms. Also, Mirin Manoff said in their case series study that all intradural spinal metastases were in patients who had lesions in their posterior fossa. In this study, 70 patients had brain metastasis and 30 of them had cerebral lesion. So we consider that cerebral lesions were associated with an increased risk of spinal metastasis. This slide shows the previous reports about prognosis factor. Our study also suggested that intrathecal chemotherapy was identified as a good prognosis factor. On the other hand, having cervical collision was a prognosis factor which had not been reported yet, but the details were unknown. Conclusion. We conducted a retrospective evaluation of spinal seeding cases to analyze the prognosis factor. Brain metastasis was observed in 70 cases, suggesting that the probability of metastasis via cerebrospinal fluid would be relatively high. This study indicated that cervical collision and intrathecal chemotherapy were associated with overall survival. Thank you for the attention.